Well, the Vision 2020 program is really an initiative of the World Health Organization to eliminate all preventable causes of blindness by the year 2020. The World Health Organization is also working with other partners, namely the International Agency for the Prevention of Blindness, known as the DAPD, and this agency is actually a collection of non-governmental organizations and professionals related to the field of eye care. And we know that blindness is mostly a problem that affects older persons. We know now that the population in the world is increasing. We know that the number of persons living older is also increasing, and therefore we should recognize that the problem of blindness will increase. We know about 80% of persons who are blind live in the developing countries, and this is an added impact on their socio-economic development. We know that 80% of blindness are preventable. We can either cure it or we can prevent them from being blind. And hence, in 2000, this program was launched so that each country become more aware of the causes of blindness in their region, and also to determine the strategy for how they can go about to prevent blindness in their region. In July 2000, the Caribbean region launched their program, their Vision 2020 program, and this was launched in Tobago. And we developed for our region the 5 eye conditions that we would like to address. And these are cataracts, which is the leading cause of preventable blindness, about 48 to 50%. And we know with surgery we can restore vision from blindness due to the cataract. The next large cause is glaucoma, which accounts for about 14.8%. And then you have diabetic retinopathy, which accounts for about almost 9%. And then the other 2 causes are childhood blindness and refractive errors. Childhood blindness is not really a big problem for us in terms of numbers, but we look at it in terms of the number of blind years. If you take an 80-year-old and they become blind at 80 and they die at 85, you have only 5 years of supporting this person as a blind person. However, if a child of 1-year-old becomes blind and they die at 80, you have 79 years of supporting that person. So although in terms of numbers we do not have many blind children, but because of the number of blind years, it impacts socioeconomically too. Refractive errors are the need for glasses. And it is estimated anywhere between 20 to 40% of children going to school need some form of glasses to improve on their vision. Also, we know that persons over 40 need glasses. Over 40% of them will need some form of glasses. So they will have to get their glasses to improve their vision. You'd be surprised the number of persons walking around functionally blind, meaning that without their glasses, the level of their vision is that of a blind person. And with glasses, we can get them to see 20/20 again. So the 5 main causes: cataracts, glaucoma, diabetic retinopathy, childhood blindness, and refractive errors.
Well, DAPD is doing its bit in relation to Vision 2020, the right to sight, and we are doing so on a social and educational level. What we have realized is that not much is known in Dominica with regards to this project, to this initiative. And as an organization that places a lot of emphasis on advocacy, we have included as part of our 2010-2014 program, the Blind Awareness Month, and this we observed during the month of May. Now, during that time, we organized activities focusing on the Vision 2020 initiative, but doing so primarily to get members of the public out there who have not yet, or who still have, or who have vision, to understand that it is important to preserve their sight. But in the event that you are blind and your sight cannot be restored, then we conduct and organize activities to assist you. We believe that persons who are blind and visually impaired have a right to education, they have a right to access the physical environment, and they have a right to equal and inclusive services. But here in Dominica, the facilities, the services, the opportunities are limited. And so, in a very small way, we try to assist. And during the month of May, we organize activities, recreational activities, social activities, and educational programs. We have programs on the radio and on the television, and one of our major events is our fundraising dinner, which we hold under the theme Dinner in the Dark. Now, this event targets persons who are sighted, and during the dinner they are supposed, or we have all the lights turned off, everything is in darkness, and the persons are given the meals and asked to eat in the dark. And then after that we discuss the whole exercise, because we just want them to experience blindness and to get them to appreciate, their sight more, and understand what we are trying to say, that you need to preserve your sight by visiting your ophthalmologist regularly, having your eye examined, and knowing more about the various diseases that cause blindness. We also do sporting activities, and one of our specials is cricket for the blind. Although in recent times we have not been able to do this event as often as we would have liked to because of funding constraints, but persons who are blind and visually impaired really enjoy playing cricket. Some of them were cricketers before, and after becoming blind, they are not able to continue playing the conventional cricket, so the blind cricket is an opportunity for them to continue to play, and this they enjoy very much. We have had a cricket for the blind team. We have been part of the Windward Islands Cricket and Sports Association for persons with impaired vision. We have also participated in the West Indies Cricket Council for the Blind regional tournaments, which they hold annually. But being a sub-region and trying to get the 4 Windward Islands to come together, it has been extremely difficult. So St. Lucia and Dominica were the ones spearheading the whole initiative. But of course, as I said, we have been severely constrained due to lack of funding, and we have not participated in a regional tournament for the last 4 years. Additionally, we do what we call our Wheeler Walkathon, where we have persons who are blind and visually impaired participating as well. So it's also a fundraising activity, and we try to do it during the month of May, so that we can all continue to create the awareness and have persons who are blind and visually impaired contribute to the development of the association, let persons obviously see how persons who are blind and visually impaired operate and function, because we have them all there in the forefront, and they are being assisted by sighted persons whom we teach how to guide them, and so on. So it's a whole learning process for everyone.
For cataract cataract surgery, the WHO has provided a cataract surgical rate, which is the number of cataracts you have to do per million population to achieve the objective of eliminating blindness by the year 2020 for cataracts. And it is estimated to be about 2,000 cataract surgery per million persons have to be done. In Dominica, the last time we checked, I did 181 cataracts for our population, and it took us well over the 2,000 per million. So in terms of being on target, Dominica is on target for achieving the elimination of blindness by cataract because of our excellent cataract surgical rate. In Dominica, the type of cataract surgery that is performed is called extracapsular cataract extraction and intraocular lens implantation. What do I mean by this? First of all, the patient is not put to sleep to do the operation, but an anesthetic is administered around the eye, and I introduce the needle for the anesthetic just beneath the eyeball, and the injection goes around the eye and at the back to numb the eye. Once the eye is numb, then I make an incision in the cornea at this upper level. Now I have access to inside the eye. However, this is just for demonstration. We do not take out the half of the eye like this. Once I can get into the eye, I remove the cataract and I replace it with the intraocular lens, which is like a little glasses. This is the clear, this disc-like area provides the refraction of the light to replace the refraction lost by the removal of the cataract, and this is called a haptic, which are the little legs that keep the lens in place. So here I hold the lens like this, and then I introduce it into through the incision into the position where the cataract was located. Now, in order for it to stay in that position, I leave behind the envelope of the lens. So I remove the inside of the lens, but the outside, which is called the capsule, I leave it in place so that it is like a little bag or a little envelope waiting for me to place the intraocular lens in the location. Once this is done, sutures are placed, or stitches as it is locally known, to close the incision. The eye is then patched and the patient is discharged home. When the patient goes home, they can eat their food, they can watch television, but there are some restrictions on their activities, which was given to them in their pre-op education session with the nurses. In terms of the glaucoma, well, glaucoma is a very difficult disease to do screening for because there is no one simple screening procedure. You've got to do an eye exam, you've got to look at the optic disc, you've got to do the eye pressure, and you have to do a visual field, which is a computerized test for mapping out the peripheral vision. So it is difficult to go in the field and do a screening for glaucoma. But what we have done, and which is now established throughout the world, we do what is called opportunistic screening. So, which means that irrespective of what the complaint is, once a person comes to the eye doctor, they are automatically checked for glaucoma. So the eye pressures will be checked, the optic nerve will be examined, and if there is any suspicion, then they will be asked to do a visual field test and starting on treatment. So we do opportunistic screening for glaucoma using this method. In terms of diabetic retinopathy, in 2005, we started a fundus photography screening program to detect diabetic retinopathy in our patients. These patients, they are very peculiar in terms of, if you do not check them, they cannot tell you they have the disease because they will not know unless it affects their vision. And so if you ask for all diabetics to make an appointment to see the eye doctor, you may find somebody with very severe disease and may make an appointment and they get a year appointment. And they're sitting at home, and by the time the appointment comes around, they have lost their vision and nothing cannot be done. So we had to devise a way of getting to these patients and having them come in earlier to see the eye specialist. And so we started this fundus photography program. And actually, because of our initiative in Dominica, Dominica was chosen by PAHO to be the pilot site for developing a program for screening for diabetics. And so we had a nurse trained at the University of Ottawa Eye Institute, and she goes out into the district with her camera, and the screening clinics are scheduled exclusively for diabetics. And she goes into those clinics, she does the photography of their eye. It is downloaded onto her laptop computer, and she can see immediately whether they have any diabetic retinopathy. She can also use this opportunity to teach the patients about the disease and their eye, because the patients will be able to see themselves on the computer what is happening at the back of their eye. Now, once she detects they have retinopathy, she automatically gives them an appointment to see me, so they don't have to go through the hospital appointment system.
What we are merely concerned about, though, is the fact that when persons acquire blindness, the rehabilitation and adjustment aspect is very, very limited. There is need for an adjustment to blindness technician, or what we used to refer to as rehabilitation officers. And this is a challenge for us in Dominica, because now there are many adults coming down with blindness and who need that support service. There is need for retraining. There is need for you to be able to know how to function in your home, to adjust, on becoming blind. Because when one becomes blind, there is a life after blindness. That doesn't mean that you just have to, retreat and find yourself, in the back rooms and not participating, being very dependent. We are saying to them that once there is no need for you to feel sorry for yourself and to withdraw from normal activities. But as I said, we do not have the technicians and the rehabilitation officers to go out there and do that kind of thing. So, in a limited way here, we do a little training. Like, for instance, we have persons who we give white canes to, and they are trained to use the cane, but we do not have an established rehabilitation program where it will run, say, for about 3 to 6 months, where the person who has acquired a blindness, his or her blindness, is assisted to live in a different way, but to live in an ordinary way as well.
I recognized very early that there was a deficiency in rehabilitating blind persons in Dominica. And so I sought with the Caribbean Council for the Blind to train a Dominican, Ms. Lisa Watty. She was trained as a rehabilitation officer for the blind. And it was my intention that she would be employed by the government of Dominica to perform that function within our health services, or even within our social welfare services, because most times the problems you encounter also have a social welfare component. However, we were never successful in getting her gainfully employed in the government service, and so we have lost the opportunity of having an established rehabilitative program within the government service. I am still hoping that one day this will happen, because we have a significant number of persons who are blind who need that service. and it was recently highlighted by persons who are engaged in the Yes We Care program. A number of them accompany their clients to have their eye care done, and a number of them have met me and expressed their frustrations in coping with blind persons, because they recognize there are certain skills that they should have to be able to manage these persons, and they do not have access to those skills. I have communicated that already with the DAPD organization to see how best they can liaise with these people to provide them with some form of lecture or skill acquiring program. But this is one of our deficits, and we should really, because being blind should not relegate you to being an outcast of society. We have this young guy who is now in secondary school doing quite well at school. We have a blind person. Recently in Barbados, they appointed a senator who is a blind person herself. And we've seen in New York, you had mayor, one of the important persons in New York was a blind person. And so in Dominica, we should really try to enhance the living skills of these persons, and they can continue to contribute, to their own livelihood and that of their family and the country.
As I mentioned earlier on, persons who are blind and visually impaired have a right to access the physical environment and a right to equal and inclusive services. You will agree with me that our environment is very disability unfriendly, and you will find that not many persons who are blind and visually impaired are visible out there using their white canes. And of course the whole issue of rehabilitation and lack of rehabilitation is a factor. But we have been advocating for physical access to be improved, and that persons with visual impairment and other types of disabilities are able to access their physical environment more independently. And we have seen some developments in that regard, where a number of the business community are now making their facility more disability friendly in terms of providing access. We hear of government's intention to build new schools and new hospitals with the necessary access. But what we are looking towards is having the Convention on the Rights of Persons with Disabilities ratified, which will address all these issues and all these concerns in relation to access to the physical environment, access to education, and even in the area of employment. So that is where many persons who are blind and visually impaired suffer. They are not able to attain a very meaningful employment, and it all has to do with the facilities, the services, personnel not available, and provisions not being made to accommodate persons with disabilities, and the need for retraining and education. And so this is where we think and we believe that the Convention on the Rights of Persons with Disabilities is going to be useful in ensuring that persons with disabilities really enjoy all the fundamental human rights and freedoms that so many out there take for granted.
I'm the only ophthalmologist in government service and in Dominica, really. So it is a lot for me to do, and we have been creative in getting other forms of assistance. I will have to pause here and make mention of the VOSH team that comes every year to do screening clinics. They do coordinate with us, so there will be a preliminary meeting in the October following their January, before their January visit when they usually come, and we will look at the areas they visited before and decide which other areas they need to go to and what needs to be done. And they coordinate with the ministry who provide assistance in some way to the Rotary Club to assist them. And not only do they provide glasses, but they also do a form of screening. So they detect patients with diabetes or cataracts or glaucoma or any other eye problems that need regular eye care, they refer them in. WASH means voluntary optometric services to humanity, and it is that the group that comes here comes from Michigan, and they are optometrists by profession, and they come in with other volunteers from other professions that assist, and they will collect glasses, usually use the glasses that are still physically in a good condition, and so they will use this to give to the people who come to them at a nominal fee. I think it's about $20 or so, but if the people cannot afford, usually they will still provide it, the glasses to them. So before somebody go about without glasses, and so they will get this. That usually spurs people to come in and get a proper check and buy proper glasses and so. But so that helps a lot with our screening program for various eye problems in Dominica. Our association with the DAPD, Dominica Association of Persons with Disability, really is with the rehabilitative fees. So if I come across someone who I have assessed as being blind, then I will recommend to them to join the DAPD to be able to enhance their to adjust, what they call it, adjust their life to live in with their blindness. And this may be in terms of social skills, in just walking out or in their home, or even becoming computer literate as a blind person, so you can continue to communicate with the outside world, or even get a job through that means.
Okay, so what we would like to see is that the necessary policies are developed and laws enacted to enable persons with impaired vision, and of course other persons with other types of disabilities as well, to be able to function and contribute and participate more effectively in the island's development. We have demonstrated that we have the capability and the ability to do so. We have a number of success stories, we have examples that we can refer to, but the powers that play their part and ensure that persons with impaired vision, persons with disabilities are integrated equally into the life of the society. I cannot stop mentioning the importance of the Convention on the Rights of Persons with Disabilities, which we are hoping that our government will ratify soon. We have been conducting a number of educational programs in that regard, and we are looking forward to receiving positive feedback from government in relation to this convention, because we know that this convention is going to correct and improve the situation of persons with disabilities in Dominica.
Because it is dealing with me and my work, persons may feel that I want to, just enhance myself. But I can safely tell Dominicans, when I go out of Dominica to regional meetings and even international fora to talk about eye care, Dominica is way ahead there with our limited resources. But we have committed staff. I'm not only talking about myself, I'm talking about our nurses. If they see we have a big clinic coming up, they will come to work from 7 o'clock to start things going. And if we have to stay till 4 or 5 o'clock without lunch, they will do it. They will not complain, you know. I have been the district nurses doing the coordinating the eye clinics out in the district. They too do a wonderful job. So we have dedicated staff. Special mention have to be made of the ophthalmic technicians in their dedication to their work. We have Mrs. Annabelle Peters-Lewis, who works in the hospital alongside with me, screening the patients. And then we have Ms. Nathalie, who is the one who is going out into the district to do the screening for the diabetics. In conclusion, I have to say that Dominica has achieved a number of the targets set up in the Vision 2020 program. That is despite we having the signed declaration of the Vision 2020 program. We have a number of areas we would like to see improved or established. One of our biggest areas needed is infrastructure. The eye clinic is now located in the obstetrics clinic. Before that, we were located in a room cut off from the physiotherapy department. The eye clinic needs its own location. We have been making plans from the year 2000 to do so. We have the plans drawn up. We've had the plans sent out for tendering. Our donor has given us over $1 million, and to date, we are still waiting to be located in our own home. This is necessary to improve the service, to be able to see many more patients, to be able to accommodate additional staff. We need another ophthalmologist, yes. However, an ophthalmologist needs their own examination room with their own set of equipment. And at this current time, we do not have those resources to accommodate a second ophthalmologist. In addition to this, we need additional pieces of equipment. We need certain members of staff to be appointed, and we needed to establish our low vision program to help rehabilitate persons who are not blind but whose vision is severely affected. We also need to establish the rehabilitation program for adjustment to living by blind persons. But when we look at the global picture of Vision 2020, Dominica, with its limited resources, has done a lot to achieve their goal of eliminating all preventable causes of blindness by the year 2020. Thank you.